Top reasons to go to a New York pain clinic. As many people often will first turn to their family doctor or primary care physician in the face of pain, the question will sometimes arise, what can a pain doctor do for my pain, or what can my family doctor do for my pain? Primary care physicians are just that. They are trained to provide primary care. New York Pain Clinic are available to help their patients with ongoing care for overall good health and to provide preventative care. Primary care physicians are integral to the health of the public at large in that they are to care for all members of your family at all stages of their lives. From minor injuries to illnesses to yearly wellness exams, primary care physicians have been trained to assist their patients with basic medical needs. New York Pain Clinic truly care for their patients and want the best for them and for their health, which is why, when faced with chronic pain, primary care physicians will often turn to pain management physicians for help. Primary care physicians are able to provide their patients with short-term medications and solutions, but a chronic pain patient, by nature, needs ongoing pain management care. Pain management physicians are able to provide procedures and alternatives to medications that primary care physicians are not trained to provide. Conversely, for basic healthcare needs, you would not seek the care of a pain management physician, which proves that physicians of all disciplines and specialties can work cohesively to provide patients the best care possible, no matter their medical needs. A New York Pain Clinic can bring together pain doctors from various specialties who can pool their expertise to come up with an individualized, comprehensive game plan to treat your pain. Treatments at a pain clinic can range anywhere from medications and state-of-the-art procedures all the way to hypnosis and acupuncture. A multidisciplinary pain center is typically staffed by anesthesiologists, neurologists, physical medicine and rehabilitation doctors, psychologists, physical therapists, and acupuncturists. Be sure that the pain doctor you visit is board certified in the specialty of pain medicine. The first pain doctor you should see is your family physician, even if he later decides to refer you to a back pain specialist. Your family physician, also known as a family practitioner, will know your medical history and has the training and expertise to spot any conditions or symptoms that might require more specialized attention. A New York Pain Clinic doctor is more than qualified to determine if your back problem is beyond the scope of a simple strain or sprain. Plus, he is in a better position than anyone else to recommend the correct specialist should you require one. If you don't have a family physician, you can locate one here. In addition, many communities now have walk-in clinics, also known as immediate care clinics, where you can see a family practitioner without an appointment and usually for a very reasonable fee. Considering that 90% of all back injuries are only minor strains, there is no reason to assume that you need to see a pain doctor. If your family physician determines that you do indeed require specialized treatment, he may refer you to a physical therapist, a physiatrist, an orthopedic surgeon, a neurologist, or a neurosurgeon.